All right, good evening, everyone, and welcome to our first, not our first AOA, but our first AOA committee led session for a really long time. We've missed you guys so much. And this afternoon, we're going to be talking about everything breast cancer, all your questions that you may have. We really want to get in depth with this topic so that we leave learning or having a better understanding than we can. No, I hope you guys are wearing your pink. I'm still wearing my pink, even though we're online. And amidst the weather that's going on, I'm very thankful that we still have an online platform where we can come, where we can worship, where we can still gather, even though it's not in person. No, I want you guys to do one thing for me, and that is to share the link. This is a very, very important topic that we're going to be discussing this afternoon, especially to women, to your sisters, to your nieces, to your friends, anyone and everyone that you believe can benefit from this topic and this discussion this afternoon. I want you to share the link with them. I also want you to come with your questions, with your misconceptions, with your queries, because this is the place for us to discuss and to leave with some factual understanding and statements about breast cancer as women and as men. Now, we're going to give everyone some time to come in and to gather and settle. So while we are doing that and while you are sharing the link, we're going to listen to some songs to set the mood and set the tone for this afternoon. And remember, share the link. Share the link. We don't want this to just be, another program. We really want this to reach as many people as possible. Again, thank you for those that are here.
Good morning and happy Sabbath. I pray that you'll be blessed by the ministry of this song. It's called Mercy Walk In. I stood in the courtroom, the judge turned my way. It looks like you're guilty, then what do you say? I spoke up, Your Honor, I have no defense, but that's when mercy walked in. Mercy walked in and pleaded my case. Called to the stand, God saving grace. The blood was presented that covers my sin. Forgive them when mercy walked in. I stood there and wondered, how could it be that someone so guilty has just been set free? My chains were broken, I felt born again. That moment that mercy walked in. Oh, mercy walked in and pleaded my case. Called to the stand, God saving grace. the blood was presented that covers my sin, forgiven when mercy walked in. The blood was presented that covers my sin, forgiven when mercy walked in.
I hear the sound of a mighty rushing wave, and it's closer now than it's ever been. I can almost hear the trumpet. Sounds the call at the midnight cry. We'll be going home when Jesus steps out. His children, the dead in Christ shall rise to meet him in the air, and then those that remain shall be quickly changed at the midnight cry. We'll be going home. I look around me and I see prophecies fulfilling, and the signs of the times said they're appearing everywhere. I can almost hear the Father as he says, "Son, go get my children." No, at the midnight cry. Oh, when Jesus steps out from the clouds to call his children, the dead in Christ shall rise to meet him in the air, and then those that remain, those who remain, they shall be quickly changed at the midnight cry. Oh, at the midnight cry. At the midnight cry. We'll be going For your mercy never fails me. All my days I've been held in your hand. From the moment that I wake up until I lay my head, I will sing of the goodness of God. And all my life you have been faithful. And all my life you have been so, so good. With every breath that I am able, I will sing of the goodness of God. I love your voice. You have led me through the fire. Darkest night, you are close like no other. I've known you as a father. I've known you as a friend. I have lived in the goodness of God. And all my life you have been faithful. And all my life you have been so, so good. With every breath that I am able, I will sing of the goodness of God. Your goodness is running after, it's running after me. Your goodness is running after, it's running after me. With my life laid down and surrendered now, I give you everything. Your goodness is running after, it's running after me. Your goodness is running after, it's running after me. Your goodness, Lord, it's running after, it's after me. With my life laid down and surrendered now, I give you everything. Your goodness is running after, it's running after me. And all my life you have been faithful. All my life you have been so, so good. With every breath that I am able, I will sing of the goodness of God. And all my life you have been faithful. And all my life you have been so, so good. With every breath that I am able, I will sing of the goodness of God. I will sing of the goodness of God.
Testing. And good afternoon, everyone. I want to welcome you to Airway again. I hope you wear your pinks at home. My job today is to do the aim, message, and the pledge. So you can interact wherever you are right now. The aim, the outward message, all the world in my generation. The motto, the love of Christ compels me. The pledge, love the Lord Jesus and promise to take an active part in the youth ministry of the church, doing what I can to help others and to finish the work of the gospel in all the world.
All right, good afternoon, everyone. Again, for those of you who I have not greeted as yet, our devotion for this afternoon is entitled Fighting Fear with Faith and Laughter. Fighting Fear with Faith and Laughter. Be strong and courageous. Do not be afraid or terrified because of them, for the Lord your God goes with you. He will never leave you nor forsake you. Deuteronomy 31, verses 6. Cancer isn't funny, and we all know that. But humor is healing. As someone who has gone through breast cancer, a mastectomy, chemotherapy, reconstruction, and gratefully came out on the other side, maybe a little lopsided, I've learned firsthand that laughter helps big time. From badly going where I'd never thought I'd go to losing 30 pounds in 30 days, the chemo diet way, humor has been an effective weapon in my fight against this disease that is no respect of persons. And before I go any further, this is Mrs. Laura Jensen Walker's story on her fight. The cancer survivors I've talked to over the years say what helped them through their ordeal was faith and often humor. I agree completely, but this is not to say I laughed throughout my entire cancer experience. I certainly did not. Yet, throughout most of my cancer ordeal, people kept marveling at my good attitude and wondered how I could stay so positive and upbeat during the experience. The answer is God. And let me say that again, the answer is God. The other answer is they didn't see me that lonely, terrifying night at 3 a.m. in the hospital following my second chemotherapy treatment when I fearfully confronted the very real possibility that I might die. Even though my husband Michael was asleep on a hospital cot right next to my bed, I didn't want to wake him because as much as he loved me, I knew he couldn't prevent death from claiming me. I never felt so alone or so scared. Frantically, I grabbed my Bible from the nightstand and started paging through it as I inwardly cried out to God, help me, God help me. And he did, with the words of Psalm 18, 16 to 17. In my distress, I called to the Lord. I cried to my God for help. He reached down from on high and took hold of me. He drew me out of deep waters. He rescued me from my powerful enemy, from my foes who were too strong for me. Chemotherapy and death were my foes that were too strong for me. But God promised that he would rescue me, and my terror subsided. As I continued to read his word, the Psalms were echoing the cries of my heart to God. I cry to you, Lord, I say, you are my refuge. Listen to my cry, for I am in desperate need. Rescue me from those who pursue me, for they are too strong for me. Set me free from my prison that I may praise your name. In that moment, my fear was replaced with a wonderful sense of absolute peace. I knew with a complete, unshakable assurance that my Lord would rescue me. I didn't know how, only that he would. Whether that meant healing me or taking me home to be with him, I was no longer afraid, for I belonged to the Lord. I am his, and nothing can change that. Not cancer, not chemo, not even death. Yes, death could claim my cancer-ravaged, chemo-riddled body, but it could never touch my cancer-free soul. In Deuteronomy 31:6, the Lord promised he would never leave me or forsake me. Be strong and courageous. Do not be afraid or terrified because of them, for the Lord your God goes with you. He will never leave you nor forsake you. He has never left me, and I know he never will. For that, I am eternally grateful. Lord, your faithfulness endures forever. Your loving kindness is without end. You teach me to laugh when joy is hidden. You turn my sorrow into gladness. Thank you for using my life to help others and to heal what was intended to harm. I praise your holy name. In Jesus' name, amen. Now, this afternoon, as I would have mentioned before, we're going to be talking about all things breast cancer. We're talking about facts, myths, misconceptions, everything. And to bring that discussion, or to lead that discussion rather, is Mrs. Dr. Natalie Graves. But before she comes on, I'm just gonna let our first elder play a song for us while we wait on her to just gather her stuff. So I'm asking you to bear with us a little longer. We're soon there, and enjoy this short intercession.
Understanding breast cancer. Breasts are made up of fatty tissue. They contain small chambers called lobules where breast milk is made. The milk travels through tiny channels called ducts to reach the nipples. Lymph nodes are located inside your breasts and under your arms. They are connected by lymph vessels and they help your body fight disease. Breast cancer occurs when healthy breast cells become abnormal, grow out of control, and form tumors. Breast cancer can sometimes spread to other parts of the body. About 1 in 8 women have a lifetime risk of getting breast cancer. For men, the risk is 1 in 1,000. Breast cancer that develops inside the milk ducts is called ductal carcinoma in situ, or DCIS. When DCIS spreads into surrounding tissue, it is called invasive ductal carcinoma, or IDC. Abnormal cells can develop in the lobules of the breast. They are called lobular carcinoma in situ, or LCIS, and are not cancer. When these cells spread into surrounding tissue, they become a cancer called invasive lobular carcinoma. Signs of breast cancer can include a lump in the breast or armpit, a change in breast shape or size, nipple changes or discharge, and skin changes including redness, inflammation, or dimpling like the skin of an orange. Risk factors for breast cancer include older age, dense breasts, having breast cancer before or having a parent or sibling who had it, having specific inherited gene mutations called BRCA1 and BRCA2, having Ashkenazi Jewish ancestry, drinking more than a small amount of alcohol, and being overweight or obese, especially after menopause. Screening for breast cancer can help find cancer early and save lives. Screening includes examining your own breasts, having a healthcare provider examine them, and having an X-ray of the breasts called a screening mammogram. You can check your own breasts about the same time each month. Feel each breast and armpit and look for any of the signs of breast cancer previously discussed. A diagnostic mammogram is used when a change is seen on a screening mammogram. It includes extra detailed images of the breast. A breast ultrasound is often used to determine if a suspicious lump is solid or fluid-filled. A fluid-filled lump is often benign or a cyst, while a solid lump can be cancerous or a benign fibrous growth. A breast MRI shows more detail than a mammogram and is often used for very small masses or changes in the breast that cannot be seen by mammogram. A breast biopsy is a test that removes a few cells or a small amount of tissue from the suspicious area in the breast. There are various types of biopsies. A doctor called a pathologist will analyze the breast biopsy tissue by looking at the cells under a microscope and doing specific tests. Their report will let you know if you have cancer and if it grew because of estrogen, progesterone, or HER2/neu protein on the cancer cell. The results of these tests help your doctor choose the right treatment. Doctors classify breast cancers based on how they behave. This includes non-invasive, cancer that has not spread outside the tissue where it began; invasive, cancer that has spread and invaded healthy tissue; recurrent, cancer that returns after it was treated; and metastatic, cancer that has spread from the area where it started to other areas of the body. Common types of breast cancer are invasive ductal carcinoma and invasive lobular cancer. Less common types of breast cancer include inflammatory breast cancer, tubular breast cancer, colloid breast cancer, and metaplastic breast cancer. Triple-negative breast cancer means the tumor has no estrogen, progesterone, or HER2 protein receptors on its surface. Triple-negative disease may have a worse outcome and often requires more intensive treatment. Breast cancer staging is determined by the size and location of the cancer and whether it has spread to other areas in your body. Breast cancers are graded 1 through 3, with 1 being the most similar to normal, healthy cells, and 3 being the most different from normal cells and the most aggressive. Breast cancer treatment depends on the type and stage of your cancer. You will need treatment from a cancer team specializing in different areas of medicine. The main treatments include surgery, radiation, chemotherapy, hormone therapy, targeted therapy, and combination treatments. Common types of surgery for breast cancer are lumpectomy, removing the tumor and a small portion of healthy normal tissue around it. Simple mastectomy, removing the entire breast. Modified radical mastectomy, removing the entire breast and lymph nodes under the arm. Prophylactic mastectomy, removing one or both breasts to reduce the risk of developing breast cancer. Mastectomy with reconstruction, reconstruction at the same time as removal of the breast. Sentinel lymph node biopsy, a procedure to determine if one or more lymph nodes contain cancer cells. And axillary node dissection, surgery to remove lymph nodes in the armpit region. Reconstructive surgery is a procedure done to restore the appearance of the breast after a mastectomy or large tumor removal. Radiation therapy uses radiation energy to kill cancer cells. It is mostly recommended after surgery or chemotherapy. Chemotherapy is the use of drugs to destroy cancer cells. It is given as an IV or a pill. Chemotherapy can be used to shrink a tumor before surgery, called neoadjuvant chemotherapy. Kill cancer cells after surgery, called adjuvant therapy, and control metastatic breast cancer, called palliative chemotherapy. Hormone therapy is given if your tumor is positive for the hormones estrogen or progesterone. Hormone therapy is used to lower the risk of breast cancer coming back and help shrink or slow the growth of metastatic estrogen receptor-positive breast cancers. Tamoxifen and aromatase inhibitors are common hormone therapies for breast cancer. Targeted therapy uses drugs or other substances to identify and fight specific types of cancer cells with less harm to normal cells. Targeted therapies stop cancer cells from growing, identify and kill cancer cells, and increase the immune system's attack on cancer cells. HER2 is a common protein that is blocked with targeted therapy, for example, trastuzumab. Targeted therapy is often given along with chemotherapy. Metastatic breast cancer is cancer that is spread from the breast to other areas of the body. The most common places are the liver, bones, lungs, and brain. There is no cure for metastatic breast cancer, and treatment is to prolong survival. Today, people are living 5, 10, or more years with metastatic breast cancer due to advances in treatment. Metastatic breast cancer treatment may include ongoing chemotherapy, hormone therapy, targeted therapy, and new innovative medicines in clinical trials, such as immunotherapy. Survivorship is a term used to describe anyone who has had breast cancer and is still living. As a survivor, you will have different care needs than when you were in treatment. Your cancer team and primary care doctor can help you meet these needs in the years after treatment. It is frightening to learn you have breast cancer. However, the information available can help you receive timely, individualized, effective treatment that can give you the best chance of being cured. Ask your doctor or cancer team if you have any questions about your treatment plan.
Okay, I hope you enjoyed our prelude, our songs, and informative videos. Now, I'm going to ask Sister Natalie, Dr. Graves, to come and to lead this discussion and to just inform us on breast cancer, myths, facts, what we could do to prevent it, anything. There is going to be a section if you have questions. So we're going to ask you if you want to, you can use the icon, the raise hand icon, or you could put your question in the chat box that we could post the question to Dr. Natalie Graves to answer. So now, Dr. Natalie, over to you. You can tell us a little bit about yourself, what's your specialty, you think is important.
Okay, so good morning, good afternoon, everybody. And so thank you, first of all, for the invitation. And then secondly, thank you for your patience this afternoon with my delay in getting online. My name is Natalie Graves. I am Seventh-day Adventist, the Black Rock, formerly Black Rock Ebenezer Grisettes. We used to be holders back then. District was my district that I grew up in. So my home church is Grisettes. I don't go to Grisettes anymore. I now worship at the Gall Hill Company, which is in St. John. It's one of our newer congregations that my husband had moved. We had moved up there to help with that new congregation. I am a medical doctor, class of 2002, so you could do the math. So it's 21 years of being a clinical doctor. And I also have the good fortune through blessings of the Lord to also have a Doctor of Philosophy in primary healthcare management with a focus on palliative care. So most of my research has been in the area of palliative care and cancer. More recently into broader public health as well. So I lecture at the University of the West Indies. So I don't know if any of my students are online, but if you are, nice to see you. You do know there are some students that go to Black Rock. And so my job there is to coordinate one of the programs, the program in public health and epidemiology at the UWI. And in that role, I have responsibility for teaching cancer control elements of the curriculum to medical students and masters in public health students, etc. So this topic is something that is very passionate to me, and that was a long bit of intro. And I do have a PowerPoint slide that I will share at some point, but it would be nice. I see that we have a nice intimate group here, and I'm wondering if we could, for as far as it's possible at some point, share our videos when we are speaking. And I want us to start off with just basically understanding what cancer is in the first place. We're going to talk about breast cancer, and then we're going to talk about how it can be prevented, signs and symptoms, and also some elements of treatment. So anybody from Sister Pamela, who I see, Sister Sonia, I thought I saw Jamie just now. Yes, Jamie. Sister Cheeseman is here. Anybody at all? What do you understand by the term cancer? If someone asks you to define cancer, how would you define it? And that is an open question. And I don't have any prizes, so.
Hi, good evening. Can you hear me?
Yes.
Okay, no, I do not know a lot. When I hear the word cancer, or when I am hearing the experiences of others, it seems as if there is some, don't want to call it a fight, but in our bodies with the cells, they say they're good cells and they're bad cells. And from my understanding, it seems as if cancer is the growth of the bad cells. And I hear about cures such as chemotherapy that's used in the treatment of cancer. And one of the negative things I've heard about chemotherapy is that chemotherapy not only destroys the good cells, but the bad cells. So sometimes it's depending on the body and the strength of the body at the time. Sometimes the bad cells win the battle or win the fight. And that's my take on it.
Okay. So your name just came up as Zoom user, and I want to know you better than to say Zoom user. So can you give us your name, or at least give me, because the others might recognize your voice.
I didn't realize it came up as Zoom user, so I will have to change it. But my name is Sonia Jackson.
Okay, right. Okay, yeah, I see it now. Okay, so thanks so much for that, Sonia. So some very useful information there that we can use as part of our launch, and some of the things that we can talk about in terms of demystifying, especially as it relates to chemotherapy, perhaps. Okay, Sister Pamela, I think I see your hand, or I see you.
Yes, please. Thank you very much, Sister Natalie. Yeah, when I think of cancer, I just think about these malignant cells just increasing by leaps and bounds. And we have to try to curtail them. So this is where the chemotherapy comes in, to try to keep them at bay. But I know there's a lot to it. And this evening, we are really looking forward to your presentation to see if at all possible, if it's something that we can do to keep them at bay. Okay, thank you.
Okay, so Pamela has spoken about malignant cells, or cells that have uncontrolled growth, and also we can talk about what causes them to be malignant, in that they have the ability to also metastasize and spread to other parts of the body. And Kiona is offering in the chat the uncontrolled growth of cells in our bodies. I just want one more, and then I'm going to describe it in a way that I think might be useful. Anybody else? Maybe one of the gentlemen. I know, Ansuni, you have responsibilities, and Brother Graves, I see you. I'm wanting a gentleman to step up and step in. So I can only see Ansuni, and I can see Elder Graves. Is either of you able to step in and give us your definition of cancer? I think that might be a no.
Well.
Oh, okay, yes, I'm hearing a bell coming in. Yes.
Yeah, Earl Garf is coming in.
Okay, cool.
Okay, so this is not technical at all, but my understanding is cancers are well, one of the features, as I understand it, is a cell where the natural life cycle of the cell is destroyed, so that the cell no longer, it does not, I don't remember what the technical term is, but it doesn't die, essentially. It doesn't die. So instead of going through the normal life cycle, it keeps growing and multiplying and essentially dominating the others. Well, yeah, I'll just add that to whatever else was said.
Okay, so I know you. It's interesting that you said I'm not sure, and then you went on to give one of the hallmark features. Now, my presentation, the slide set is a little bit dated in terms of the format of the slides. In terms of it's not the newer. Graphic, etc. But essentially, how God has made us, and this is what I want for all of us to remember, the way how God has made us, we are made up of billions of cells, and each cell has a function, it has a purpose, and cells are supposed to fulfill this particular purpose. And then if perchance they become damaged by anything outside of the body or even inside of the body, in terms of their natural control mechanism, if anything goes wrong with that and they're beginning to behave abnormally, they're supposed to get these natural trigger messages inside of them that say, okay, hang on a minute, you're not behaving well, you are not doing your normal function, your rate of growth might be too fast, you're triggering some immortal capabilities. And that cell is supposed to have some control mechanisms that actually cause that cell to die, to not to proliferate and make others like it, and to die. And that process of almost called natural suicide is called apoptosis. Now, what happens with cancer cells is that because of various factors, whether the inflammation that they can they build around themselves, a mechanism in the control systems that might have gone that is not working as well, they are somehow able to say, okay, I hear you. I hear the message that I'm supposed to close in on myself and die. But actually, no, I don't want to do that. I actually want to try to be immortal. And I want to create other cells that are just like me, other daughter cells that are just like me. And then more importantly, I don't want to stay where I was supposed to stay within my physical realm. So say, for example, if I am a breast cancer cell, a cell that was made to stay on the anterior part of the chest or to the front of the chest and to be involved in the production and manufacture of milk or some other hormones, etc., or some other function, that cell decides, I don't want to stay where I was intended. I want to get into the bloodstream, or I want to get into another channel pathway called the lymphatic system, or I want to just grow to another part of the body. And so the ability of the cell to spread and to want to spread and to spread is called metastases. And that's what cancer cells do. So one, they don't want to listen to the natural control mechanisms. They don't want to die if they're damaged and they're supposed to. They want to make other cells that are like themselves. They want to outsmart all of the natural control mechanisms, and they have the ability to spread from one part of the body to the next. Okay, so is everybody with me? So that is usually what we're talking about when we have a cancer. So there are some times where you might have a cell in the body that has the ability to grow and to produce more cells than it should be, but it does not have some of those other negative features, and it doesn't have the ability to spread from one part of the body. And in that case, you may have a growth, but it may not be a cancerous growth. It might be benign. So for example, a common example might be a mole. So say, for example, in response to pregnancy and certain hormones, you may have had a small set of cells on your skin, on your face, on your neck, but then because of response to hormones, etc., they may grow and they may proliferate and cause a larger mass, but that mass is not cancerous. But if it does if it changes in its behavior, then it could become cancerous. Okay, so I'm hoping, I need somebody to give me a thumbs up before we move on from that structure. So so Jamie or Michelle Smith, if that part is clear, you can give me a thumbs up, and or anyone else give me a thumbs up by using the reaction in the chat, and I will go on. So thank you so much. So the interesting thing is that as it relates to cancer cells, I'm going to use my hair as an example. You can all see my hair. Our hair is not living, only the root. So down here is not living. So technically it could not get a cancer like at the base of my hair, etc. But you can technically get a cancer in any cell of your body. And the way how we label cancers for the most part is you would say the cancer is named after its cell or location of origin. So we might talk about, I want some of you to tell me can you use the chat function and write some of the names of the cancers that you have heard of? Just take 30 seconds and just write a cancer that you have heard of into the chat function. So blood, yes, so you have certain blood cancers, and depending on the type of cells, the cancers might be named after those cells. So you might have myeloid cells, so you might have myeloma, you might have leukemias, etc. So those cancers tend to be named after the cells in their Latin names. So you have colon, so colon cancer. So you're thinking immediately that the cell type there, that the cell that started to behave badly originated in the colon. Same with breast, so you can see the naming, breast cancer. So the cell that is behaving badly, it would have been a cell type that originated in the colon, or originated in the prostate, or originated in the cervix, or originated in the lungs, etc. So you can tell where the cell of origin is by virtue of the name. So when we are talking about breast cancer, then we are talking about that kind of cancer that the cell line or the cell type that is behaving abnormally would have started in the breast. So where is the breast? Now we do know that everybody is not exactly the same. This is a simplified picture of the female breast, or well, the female architecture. But fundamentally, men are very similar, except that there's not a full development of some of these structures. So when we speak about the breast, we're usually talking about a tissue system that is on the front part of the chest. We do know that there are variations where some persons, their breast tissue may develop lower down onto the abdominal wall, etc. But in the abdomen, like lower down. But for the most part, you're talking about the front part of the chest. And this anterior structure was created by God in the context of, for women, the ability to make milk for the purposes of feeding infants, etc. But the breast also plays a role in sexual function and sexual expression, etc. But if you can look here, you can see that it's usually what we would say a structure that internally has two major aspects. A section called the lobes and lobules. These look a little bit like cauliflower, for lack of a better expression. And this is the section that is designed to create or manufacture milk. And then there's a system of pipes. So pipes or ducts that take the milk from where it's produced to the nipple area. Now, even in the absence of having had children, etc., this basic architecture is there. And as I said before, even in men where the development of these might not be as sophisticated because of hormones, this fundamental structure of lobes, and then lobes, lobules, and ducts is there. The lobes and the lobules are also surrounded by fat, and they're also resting on the chest wall and the muscle there, and also there is the overlying skin. Okay, so let's go through that. So you'll have your skin, you have your areas where you have your fat, then you have your ducts, which take the milk from where it's produced, and they run from the lobules, and the lobules are grouped together into lobes. And all of this is sitting on the front part of the chest. So there's muscle immediately under here. Whoops. Wow. And then your ribs, etc. Now on this slide, you can see that there's a fancy network, almost looks something like Christmas tree lights, so to speak. You'll see that there are these constellations that look like little bulbs, or almost, for those of you who are gardeners, it looks like it could be the root system of a plant. Now, how God has made us is that we have a drainage system that is part of our immune system, and that's called the lymphatic system. And accompanying the breast, we have these lymph channels and lymph nodes. So the lymph drainage for the breast, importantly, goes underneath the armpit right here. It also runs along the middle of the chest, very close to the sternum, which is that central bone. And then it also runs up the neck, and right here is where your collarbone would be. So it runs alongside the collarbone, underneath and just above. So the lymphatic drainage, or the drainage system for things related to the breast, runs up the neck, underneath the collarbone, also runs underneath the armpit. So sometimes if something is happening with the breast, we may be able to pick it up by understanding what is happening in the drains So when we get to talk about how to examine your breast, you will notice that examining underneath the armpit, examining the area around the collarbone, examining the side of the neck becomes very important. But it's kind of difficult virtually impossible to feel the lymph nodes that are underneath that middle chest bone. But all of this is very important. Okay, so let me just make sure, let me check the chat. Okay, yes, and stomach as well, in terms of how we name cancers. So that is the basic anatomy of the breast. And I want us all to remember that the similar architecture is in men, and we're going to talk about breast cancer in men as well. So if you're taking notes, I have a question for you. I want you to tell me some of the things that you have heard can cause breast cancer. And I know my slides went back and forth a little bit just now, and so you might have seen the next slide before I intended to, but I want to hear from you. What are some of the things that you have heard can cause a person to have breast cancer? So anybody, Miss Lynn, Annette Bannister, I'm hoping that Brenda's iPhone is Brenda is online. Somebody just open up and tell me something that you've heard that can cause breast cancer or can increase a person's risk of having breast cancer.
The use of alcohol?
Yes, so let me see. Let me look at my participant list. Miss Bannister has said the use of alcohol. Very good. Thank you for that. Excellent answer. Okay.
If you get a lash in the breast.
Okay, so Miss Lane has spoken about previous trauma. Okay, so the usual story that you might hear is, okay, I was playing netball as a girl or something like that, and somebody hit me really hard, and I developed breast cancer afterwards. We can talk about that. So that's two answers. So genetics. So Kiona has talked about the baseline programming of your genes. Okay. I think I heard Ergoth coming in, or maybe it was just my imagination. Okay, so breastfeeding. So breastfeeding as a cause, Brenda's iPhone. Yes. Okay. Okay. All right. Thanks for that. We will talk about it. I think somebody was coming in, but I couldn't hear.
Stress as a trigger. Stress.
Which one? Stress. Okay, so interesting. Stress. Yes. Okay, we'll talk about that. I think Sonia was coming in just now. Sonia, you want to go ahead? It's coming up as Zoom user, but I think this was Sonia before. If not, it's just another Zoom user. You can go right ahead. Your hand is up. Or maybe
excess fat in the body, excess fat in the diet.
Okay,
could that contribute?
Okay, excess fat in the diet. Okay, we'll talk about that. Okay, all right. And anybody else?
I was made on and that certain methodologies of mammograms, certain mammograms can, potentiate that.
Okay, so there's a query as to, this is another Zoom user as well, as to whether mammograms can cause breast cancer. Okay, all right, any more?
Doesn't refined meats and processed meats.
Okay, refined meats and processed meats, so maybe your diet, etc. Okay, and if anybody has a burning one that you want to come in with, then I will. No? Okay, good. All right.
So, sugar.
Okay, sugar. Okay, so I'm not sure who it was, but I got it in terms of sugar, and I'm happy to talk about all of these things. So in terms of in many instances, the exact cause is not known, but we do know things that can increase risk. So say, for example, if I were making lemonade, and I will say, okay, I'm going to put in 2 lemons. Maybe I want my lemonade all fancy. Maybe I want lemon and lime and honey or something like that. And I say, okay, if I put in 2 lemons, 1 lime, and a tablespoon of honey, and I chill it for 20 minutes, I will get this end result. There's no exact recipe of causative factors to say if you do this, you do this, you do this, then you will get this result in X or Y time. But what we do know, some of what you guys said is spot on. Okay, so what we do know about the risk factors in terms of where science is, so no one knows exactly, but we know that there are some things that will increase risk. Okay, so these are the common risk factors, and I will talk them through. So age is a risk factor. So technically speaking, our bodies are constantly facing challenges from abnormal cells. And sometimes as we age, the mechanism for taking care of abnormal cells is not necessarily as efficient as it could be. So technically, someone said wearing wired bras. Okay, so technically, anything that you can do to help yourself to age healthily is going to be important. So as I talk about the risk factors, I'm going to talk about preventative measures in the same way. So just as we age, some of those mechanisms for the immune system functioning, sometimes they are under stress or they are not working as efficiently. So things that can help you to optimize the functioning of your immune system as it relates to your aging process would be extremely important. So for women, especially women, I'm talking about in the Barbadian context, our peak age for incidence of breast cancer, meaning the most common age range for when women are diagnosed for breast cancer is between 50 to 54, that perimenopausal group. But after menopause as well is when generally worldwide, when most women will tend to get breast cancer. But we are finding that in Barbados that our women are actually in that perimenopausal period so much more so than the late 50s, 60s, almost 70s group. Our women, we're tending to get breast cancer or abnormalities earlier. So as you age, wanting to make sure that you are sleeping and sleeping well, so you're getting good quality sleep. Now, sleep is extremely important in terms of the repair that can occur if there are abnormal cells in your body. So between around 2:30 in the night or 2:30 in the morning, so to speak, that's when your body is at maximal repair. So really between 10 and 3, 4 in the morning, you want to make sure that your body is in a state of rest. We know that there are some persons, because of their jobs, etc., that they're not able to consistently get rest during these periods because maybe they're nurses or shift workers or whatever, and their sleep pattern, their natural sleep pattern is being disrupted. But we do know that sleep is extremely important in the repair of cells. So I want to encourage you, if you've not been prioritizing sleep and prioritizing good quality sleep, that you do. So you want to make sure that your room is nice and cool, maybe between 24 to 26 degrees Celsius, that it's dark enough. So that if you're going to the bathroom and you need like a low night light or the light in another room on to guide you, that's fine. But ideally it should be a dark room, which is cool and quiet, minimal stimulation of your mind, etc. before. Now, personal history is important, and I'm not sure if this is where Sister Barbara was going. So there's no strong evidence in terms of a lash or a blow to the breast, etc. But personal family history, personal health history related to something called fibrocystic disease of the breast, and sometimes that's when most people pick up that they might have a cyst in the breast, or otherwise in that they might have had a lash, etc. And they realize the area is tender, or they realize that their breasts are extremely lumpy, either before or after that particular trauma, or as they are growing and they're experiencing their monthly cycle. If it is that their menstruation is a 28 or a 30-day cycle, they're noticing increasing lumps, etc. in the breast. Some persons may have a history of fibrocystic disease. And if it is that you have fibrocystic disease and the cysts, sometimes they're expanding in response to the hormones, but also if you have a cyst drain and that cyst is recollecting very quickly, between 6 to 12 weeks, a cyst that was drained is now recollecting. That's something that you will have to get checked. So your personal history is going to be very important. So any history of cysts in the breast, in particular cysts that are very active and have a high recollection rate, you will need to be mindful of that. If you have a family member who has had breast cancer, in particular, a person in your family who has had breast cancer under the age of 40, that increases your risk. But if you have a first degree relative, so your mother or your sisters, etc., have had, or even your daughter might have had breast cancer, that's important. But also knowing the male cancer history. So because there's some, when we get down to this particular genetic subtype, that becomes important. So if you have men in your family who have had prostate cancer, especially if they've had prostate cancer at a very young age, in particular for men under the age of 50, if they've had prostate cancer, you need to be mindful, you need to be aware of that so that you can start your screening or taking steps and methods to increase the ability to detect breast cancer early. So there are some microscopic changes that can be seen that might alert a person to the fact that, okay, hang on a minute, I had a breast mouse removed. So there's sometimes you may have a lump in the breast and it's not cancerous, it's something called an adenoma, or you might have had one of those ducts has been inflamed. But when you look at it under the microscope, you can see that these cells were wanting to start to behave badly. If you start to see some of those changes when those cells are examined, you may want to make sure that you are following up to make sure that if anything changes, it can be picked up. So we talk about in situ changes. So there's within the lining of the cells, there may be abnormalities that can be picked up. Or within the breast network itself. If you're seeing some of those changes, your doctor may want to make sure that he or she is following you very closely. Now, I'm not sure if this is the particular gene type that Kiona was thinking about, but we have breast cancer gene 1 or breast cancer gene 2, BRCA1 or BRCA2. This is a kind of mutation that increases the risk of getting breast cancer. It doesn't guarantee that a person will get it, right? Remember we said nothing is a guarantee, but it does increase your risk. So some women who have this, they may prefer to start their screening very early. So you might pick up that this gene might run in your family because you've had multiple women in your family who've had breast cancer or who've had breast cancer young, or they might have had a combination of breast cancer and ovarian cancer in the family, or breast cancer, ovarian cancer, and prostate cancer. And that might trigger you that, okay, hang on a minute, our family might need to receive some counseling and to get tested for this particular kind of gene. Now, some persons with this gene type, famously, a lady who is an actress by the name of Angelina Jolie, she's been very public about her genetic makeup, and she would have opted to have what is called a prophylactic mastectomy. So she would have opted to have the breast removed and rebuilt and reconstructed because she was thinking along with her doctors that her risk was so high that she wanted to do this prophylaxis. However, that's not necessarily recommended for everyone, and it's a discussion that you will have with your doctors. Usually women who have BRCA1 or BRCA2 would not just have a mammogram, they would have ultrasound, but more importantly, they may have screening that involves the use of an MRI to examine the breast. Now, there was a question as to whether or not exposure to mammograms can cause breast cancer, and current evidence does not suggest that. The dose of radiation in the mammogram machine is very, very low, and the potential benefit in terms of life, saving a life, is seen as being greater. We'll talk a bit more about how to examine the breast and the different modalities for screening, but I want you to know that if you perchance are BRCA1 or BRCA2, the methods that you would use would be slightly different, and your doctor may actually advise something like an MRI. Now, your reproductive history is very important. We know that as time has gone on in terms of this, at least this branch of medicine, we've noted that there's a bit of a change that is happening with respect to how early girls are having their menarche or their first quote unquote period. So if you are a woman who had her menarche, entered into the process of having the monthly release of an egg under the development of estrogen, and you started before the age of 12, your body would have been exposed to more estrogen than normal. Likewise, if it is that you have reached the age of 55 and you have not gone through the menopause, meaning a complete year without having a period, if you're still regularly menstruating, then your breast cancer risk increases. Likewise, also, if you've never had a natural break from, your body has never had a natural break from the constant exposure to estrogen, meaning that you've never had children. So that's what the 0 is here, the nulliparous. So 12, 55, and 0. So if you have any of those factors, your doctor may want to talk to you about what do you do with your screening. How do you detect things early if they're occurring? Now, you will hear me mention the word estrogen in terms of one of the hormones that is produced by the female body in particular. And usually this is primarily a function, the production of estrogen is primarily a function of the ovaries as a major part of that cycle. But I want you to know that other organs in the body are involved in the production of estrogen. So in conjunction with the ovaries, there's a relationship with the liver, how the liver works and what the liver is able to do. So the liver has a part of that whole estrogen pathway, and also fat is part of that. So if you're carrying excess body weight, especially excess body weight after menopause, or excess body weight around the tummy area, what we will call truncal obesity. So if you take the measurement of your waist and then you take the measurement of your hips, what you really want is you want the area around the hips to be larger, significantly larger than the area around your waist. And if you're carrying abdominal weight, that can also increase your cancer risk. So this is why the persons who would have talked about being overweight and also thinking about what we eat in terms of things that are high in calories, but not necessarily high in nutrients and not high in antioxidants or things that might be beneficial for our bodies. That's why those things are so dangerous, because they increase the likelihood of a person being overweight or obese, and that is going to increase the cancer risk. Likewise, alcohol. So alcohol is a cancer-causing agent in and of itself, but alcohol also gives empty calories, and it also affects the way how the liver works and causes the liver and its pathway for estrogen production to be more. So that's why alcohol consumption is a major risk factor for both men and women in terms of increasing the risk of breast cancer, but also for men, especially in terms of men who drink alcohol, their breast cancer risk is also much higher. So you will see here this word here, diethylstilbestrol. This is an old drug that was used back in the 60s. I still put it here for academic purposes to speak to the issue of persons who might have been exposed to this medicine to help to control nausea and so forth. We know that this medicine, if you were exposed to it, can also increase your risk of breast cancer. Now, what is not on this list, which should be on this list, is what we will call exogenous or estrogen that is coming from outside of the body. So there are some women who, because they're on birth control, or because they might be on some other kind of hormone replacement therapy that involves estrogen, they are taking extra estrogen and putting that extra estrogen into their bodies. And we want you to know that taking extra estrogen, especially for prolonged periods of time, so say, for example, low dose estrogen use that as occurs in the oral contraceptive pill for more than 5 years, we know that will increase your risk of breast cancer. So if you are thinking about your contraceptive methods and your contraceptive planning, you want to bear in mind that taking estrogen, extra estrogen, and putting it inside your body is going to affect your breast cancer risk. So it's quite a long list of things. But one of the things that I want to demystify, because it's actually protective, is breastfeeding. Breastfeeding, if you breastfeed, it actually reduces the breast cancer risk. So breastfeeding is actually protective. So if a woman in her lifetime is able to breastfeed for cumulatively for more than 2 years, so not breastfeeding each child for 2 years, etc., but if you get more than 2 years breastfeeding, that is where the evidence base is right now. There is a reduction in the likelihood of breast cancer. So in essence, what I'm saying here is that as we age and as we grow as women, we want to be mindful of what we're putting into our bodies. So we want to be mindful not to be taking extra estrogen and putting it into our bodies, and certainly not without consultation, and certainly not without availing ourselves to screening if we are going to be taking extra estrogen and putting it into our bodies. We want to be mindful of using things that will cause our bodies to naturally increase more estrogen. So drinking alcohol or allowing our bodies to be larger than usual or larger than should be recommended. So I know that in the Caribbean, a larger body type is probably the preferred body type in terms of what might be seen as being attractive, etc. But that's not the healthiest body type, and certainly not a body type where we are carrying a lot of tummy fat. So you want to be working on minimizing and making sure that your waist to hip ratio is, you work that out with your doctor according to your weight and your size, and there are various apps and so forth that you can use. You also, I'm saying to us that we need to talk to each other in families. If you know that auntie had breast cancer and her daughter and her and so forth, or whoever, you need to know your cancer histories in families, and not just for breast, but also the clusters that can go along with it. So ovarian and also prostate, and the list is a little wider, but I will just say those two. And certainly if you know that you started menopause, menarche, had your first period before 12, if you're past 55 and you're still having a regular cycle and not gone through the menopause, if you have a history of fibrocystic disease of the breast, if for any reason your doctor told you that you had precancerous changes in your breast for whatever reason, you have to make sure. Now, as we get older, technically our breasts, we lose some of that fat, and the lobules, etc., they change in size. And you don't expect a woman who is into her 50s, late 50s, 60s, etc., to be having very, very dense, turgid breasts. If you are still carrying a breast that is very, very dense, you want to make sure that your doctor is not only just examining with his hand or her hand, but they're also requesting the necessary mammograms, but more importantly, the ultrasound. If you're an older woman and you still have very dense breasts, you need an ultrasound, not just a mammogram. That was a big dose of medication, not medication, a big dose of information. Are we fine? Because then I will go right on to the next issue. Is that clear, Dira? I didn't see your name before, so you might be joining a little late. Kiona, you can give me a thumbs up if that was clear as well, because then I will go on.
Yeah, that was clear. Just quickly, because we're doing it on YouTube as well, and some
Okay.
persons are asking about stress, weared bras, and certain medications in regards to increasing risk factors.
Okay, so stress, there's something called allostatic load, and persons can look it up. Now, allostatic load is extremely important. It's one of the newer concepts, but we do understand it. And I guess one of the things that it was picked up on, because we realized that persons who might have a lower socioeconomic status or who have been exposed to chronic stress seem to have an increased incidence of breast cancer. So if you have a chronic stress, it's going to affect the nervous system, and it's going to affect your hormonal system. So if you're constantly exposing your body to pressure, it's like, you know, when we talk about the flight or fight response, so you're exposed to a stressor, your adrenaline goes up, but it's supposed to technically come down. That has also implications to what happens to a hormone called cortisol. If your cortisol is too high for too long, it can affect the functioning of your immune system. It can affect the way your body handles weight. It can affect your desire to eat. And sometimes some people end up overeating, and then it becomes a big cycle. It can also affect or impact the way how your body manages insulin, etc. So there's a pathway that relates the way how we manage insulin to some of the other hormones that affect the risk of breast cancer. So yes, so stress, chronic stress is not useful. You don't want to be having a high allostatic load. So generally we would talk about decluttering your life, thinking about what is stressing you, who is stressing you, where is stressing you, and trying to minimize some of that stress. Now, related to the bra and the wired bras, etc., and also like similarly to the blow, there's not a lot of evidence suggesting constriction per se. But what I do want to say is that generally we want to be wearing clothing that's not going to be constrictive to our lymphatic system, and it's not going to be constrictive to our breathing or anything. Just generally, just want to make sure that your clothes are fitting you and that they are fitting you well. Separate and apart from breast cancer risk, you have the irritation that can occur by the skin to the skin if the padding for the wire becomes eroded, etc. You can have trauma directly to the skin, etc. So you just want to make sure that all of your clothing is as comfortable as possible, separate and apart from anything related to breast cancer. Okay, so allostatic load is the theory. Okay, so Sonia is asking about what about the alkaline and acidic environment of the body. And Sonia, I want to ask you this question because it's something that a lot of persons are concerned about. And I want to find out, first of all, what do you mean by acidity and alkalinity of the body? Anybody else who wants to jump right in?
Sorry, excuse me. It is said that if we adhere to a plant-based diet, that would produce a kind of an alkaline environment as opposed to acidic, where you would be taking in red meats and those kind of things.
Okay.
So that's my understanding.
Ooh. Okay. So I just want to clarify which microenvironment. Are we talking about the bloodstream environment? Are we talking about the tissue environment? Which environment is acid or alkaline, the bloodstream or the tissue? Do you know which one it is?
That's a little complicated for me.
Okay, no problem. Okay. All right, no problem. So it is something that is important to understand. So for those of you who like science and who love to think about the way how God has made the world, He has made our bodies and everything around us has a potential, an electric potential. And we have things that are acidic, which tend to carry a low potential, so to speak. And then we have things that are alkaline, and we have things that are neutral. So usually it runs from 0 to, let's say 1, but 0 to 14. So you would say most acidic to most alkaline or basic. Now, how God has made us, He has placed us in different compartments. So if I take some food in my mouth and I chew it, we have saliva that has chemicals in it, and the environment in my mouth is a different pH. That's what it has a different acidity or alkalinity than my stomach. So my mouth might be a bit more alkaline, your mouth might be a bit more alkaline. But then when we get down into the stomach, there are certain acids that are produced, and the pH in the stomach is slightly different. And its pH in the small intestine is slightly different. And the pH in the colon is slightly different as well. Also, separate and apart from what might happen in the gut, the blood, how God has made us, He wants our blood to stay around a particular level. So if we have a bloodstream that is too acid or alkaline, we get into trouble, right? So He has made it such that what you eat has to go through some filters so that it does not disturb the blood so much. So there are all these things that are working to make sure that the pH of the blood stays steady. So how we breathe helps the pH to stay steady in the blood. What we eat can help. How our kidneys work can help. So sometimes when people ask me about acidity and alkalinity, I'm kind of concerned just to make sure that I understand what they're asking. So usually when we eat, I can eat something that is alkaline, like I'm just gonna say alkaline water. By the time I drink the alkaline water and it hits my stomach, it's gonna interact with the acids and be slightly different by the time it's absorbed. So I'm not sure who I'm offending, but I'm not fully bought into the concept of alkaline water because the microenvironment in the stomach is going to change the composition of that water. However, if I use particular plants, etc., when those are broken down and when those are absorbed, etc., they might help to keep the pH of my blood and my general environment of my body in a certain way. If I take some things that are high in certain kinds of proteins, so I will use the example of cheese, etc. When my body has to take the cheese, digest the cheese, absorb the nutrients from the cheese, and filter it through my kidneys, it might put a stress on my kidneys to the extent where say for example, there are some things that you have to be super alkaline that we give to patients who have problems with their kidneys. So it won't be alkaline water, but it would be almost like a soda bicarb tablet. And you take that, and then by the time it's broken down, it gets into your bloodstream and it can help with your pH balance. So pH balance is important, but I don't want us to follow fads or crazes, and that we understand that even the way how we breathe. So we, as Seventh Adventists, we talk a lot about deep breathing. The carbon dioxide is acid. So you want to make sure that you're breathing and you're having good air exchange, etc. So it's kind of a technical thing, but to say that there are things that we can use that when we put them into our bodies, they can make the way how the kidneys have to work, they can stress out the way how our kidneys work and cause the kidneys not to balance the acid and the alkaline as well as they should. And then there are things that related to how we breathe, etc., that can also affect that mechanism. So if you're interested in reading more about that, you can look at the function of the kidney, and there's lots of stuff now that is widely available on reputable sites. So you can look at the functioning of the kidneys in terms of your pH balance of the blood and your system more generally, and also what you eat and how that affects how you break down fats and how you break down proteins and what that does to the body. So the best diet, since Sonia has asked about this, from a medical perspective, we would talk about persons using a predominantly plant-based diet as being one of the most preventative for healthy eating. Not in terms of reversing cancers or anything like that, because I know that there's lots of talk about reversing cancers, and I think we need to be mindful of which cell type we're talking about reversing, because we could be saying to one person, I reversed cancer by doing X or Y, and another person, they have breast cancer, but they have an absolutely totally different histology. And while we're saying to them, reverse the breast cancer by doing these particular methods, they are doing these things that will not work for them or will not work as efficiently. And all that time, those cancer cells are rapidly dividing. And then by the time they catch themselves, it's too late. So that's one of my, just being frank here, that's one of my major concerns about the preventing breast cancer movement, or not preventing, but reversing. So generally, we talk about avoiding alcohol, using water as your beverage of choice, and this goes back to someone else's question, avoiding added sugars. So you cannot remove sugar completely from your diet, as in you cannot remove sugars that are like in fruits and dates, etc., because the only fuel that your brain uses is sugar. And I've had some persons that have gone so extreme in this quest to remove sugar from their diet. They have lost weight because they're undernourished, and they come and they're confused because their brains are not getting enough sugar to run. So I think it's important that we teach persons how to eat well. So you're avoiding added sugar. You're using natural oils like olive oil or coconut oil, etc. Avoiding highly refined oils like soybean oil, etc. And you are using most of your fiber from whole grain sources, like we have yellow cornmeal, we have brown rice, etc. If you're using a carbohydrate, you're choosing to use a complex carbohydrate like sweet potato or breadfruit. We can talk about the phytoestrogens that might be in yam, so we can talk about that. If you're choosing to use a protein, you're using a protein that when it gets into your body, it's not going to stress your kidneys and affect that that pH balance. So you're preferring peas and nuts, etc. If you're using fruits, you're using fruits that are high in lycopenes generally. So watermelon, blood orange, guavas, pink guavas, pawpaw, those kinds of things generally. And then you're having lots of cruciferous vegetables. So but remember, cruciferous vegetables don't give you calories. They will give you phytochemicals, but it won't give you calories. So the cruciferous vegetables will be your broccoli, your cauliflower, etc. And then you're adding on top of that your berries, the berries that are high in antioxidants, what we would call the oleic acid berries. So in the Caribbean, they don't grow naturally here, but you can substitute for things also, not substitute, but you can use things that are natural here, like jamun, etc. But you have your blueberry, your strawberry. That was a very long answer, Sonia, and I hope that helps. But it's just that I could not just walk away from the acidity and alkaline argument because it comes back, right? Okay. I hope that helps. Sonia, does that help?
Yes, very much so. Thank you very much.
You're welcome. Great. Okay, so I guess we can come back to that when we get closer to the end. Yes, and then on top of all of that, you're using your water for adequate hydration, and you are exercising because exercising is going to help with your oxygen exchange, etc. That carbon dioxide exchange, the function and the efficiency of your body is just going to be better as you exercise. So that's why exercise is absolutely critical to breast. If persons have the diagnosis of breast cancer, exercise, aerobic exercise, 30 minutes of aerobic exercise daily is non-negotiable as part of your survivorship plan. Yeah, exercise is a must. Yeah, okay. So I'm seeing the chat, but I'm just going on. You start, yes, okay, Jimmy is yes, exactly. So in terms of mammography, so mammograms, for right now, they are one of the best screening modalities that we have. But before mammograms, I just want you to become aware of what your breast feels like. So this is both men and women. If you know what your breast feels like naturally and normally, then you are able to pick up when something is going wrong. Kiona, can you give me a time check? But where I am, the sun is setting. I know sometimes some churches stop to acknowledge that. Am I okay to go on, Kiona?
Yeah, you're fine.
I'm fine. Okay, good. So happy week, everybody. But monthly, you want to be examining your breast, examining your clavicular area, examining your neck, examining under your armpit. And we're going to talk about how to do that. And the best time to do it, if you are a person who is menstruating, you want to do it the week after the cycle has passed, where your body is not responding to the preparation of the lobules are not as responsive to the hormones, because it might feel a little lumpier the week prior and during, but the week after should be fine. So just if you're on a regular cycle, make sure that you are doing it monthly at or around that time. And if you're not on a regular cycle, just make sure that you can check monthly. And annually, you should have your breast examined by a healthcare practitioner. So this could be a nurse, like how the breast cancer screening program has a nurse. It could be a doctor, etc. And if you know that you have a lot of risk factors, I want you to get accustomed to talking to your doctor. Now, I have a cube in my hand. I have a 2-year, well, she's now 3 as of this month. It has different sides to it, how everybody can see the cube. My breast is not going, the set of toys that she has, no 2 cubes are the same. So it's going to be important for you to know your breast. And I know that we live in a sisterhood, so we could be talking to each other about our breast. And somebody will say, well, I see so-and-so happening in my breast. And you say, well, that happened to me, man, that's nothing, ignore it. Or you might say to somebody, I see something happening. And you say, okay, I don't know what that is, but I think you should get it checked. Let's go together. I get it checked. I think what happens sometimes is that when we pick up something abnormal, we might not have somebody that will encourage us to go and get it checked, or we might not tell anybody, and we might just be scared, and then things progress. I want to encourage you not to be scared should you pick up anything, and I want to encourage you to get it checked. And if you need to have somebody buddy up with you so that the 2 of you can go together, that you do that. If you are examining the breast, you can treat the breast very much like if you're buying produce. Us in the Caribbean, I think sometimes you can tell when somebody's in the Caribbean, how we buy fruit and vegetables. We don't just look and decide whether we want it. We have to sometimes touch and feel and make sure and inspect. And it's something very similar that you want to be doing. So you want to stand in front of the mirror. I'm going to try to be full on to the camera. And you are looking at your breasts. You're looking at both sides. Now, the breasts are usually not the same. They're not exactly the same. They're not exactly symmetrical. Just like one side of your body is not exactly a mirror image. But you're looking at yourself full on. You're looking at your breasts. You're looking at how they hang. You're looking at the nipple area. You're looking to see if there are any dents. You're looking to see if there are any bruises, any marks, any unexplained rashes, or anything like that. That's what you're looking at. Then you want to raise your hand above your head, and you want to look and see how your breasts are moving with the movement of your hand. Remember, in that one of those earlier diagrams, I spoke about the fact that the breast is up onto the chest wall and is attached to the muscle. So as you move your hands up, that muscle is going to become engaged. And if there is anything in your breast that is significant enough, it's going to pull on the muscle, is going to pull on it, and it's going to pull on the skin, and then you can get a dent. So you're looking to raise your hands, and you're looking to see if when you raise your hands, if you're seeing any dents or any dimples or anything like that in the breast. And then you want to place your hands in your waist, and you want to bend over slightly and kind of squeeze in, because you're tightening the muscle then as well. And you want to see if you're seeing any dents or anything like that. Now, usually it's good to do this. You can do this examination after you've looked at yourself in the mirror. You want to either lying down without any powder or perfume or soap or anything on your hand. You want to examine the breast, and you're going to be using the tips of these 3 fingers, so to speak. No gel, no nothing on them. And the easiest way, I think, to do it is to start at 12 o'clock, like how we go around the faces of a clock. 12, 1, 2, 3, 4, touching. And then you're coming on around and in, like how you would go to a dartboard. And then when you get to the nipple, you're going to squeeze the nipple to see if there's any discharge that is coming out. Now, if you're breastfeeding, you might get a white discharge. Even if you're not breastfeeding, you might get a white or grayish discharge. But you should never see pus. You should never see anything that is like a rich yellow that looks like mucus. You should never see anything that's green. If you see that, it doesn't mean necessarily breast cancer or anything. It might just mean that there might be some inflammation in one of those ducts, and you want to get that checked. Then after you finish feeling the nipple, etc., you want to make sure that you're checking underneath your arm. So the armpit has almost like 4 sides. You want to check the side that is against your body. You want to check the side that is against the arm, and you want to go deep up as high as possible, front and back as well. Okay, so you want to do that on both sides, and then you would just check the area here above the collarbones just to make sure that there are no lumps or anything, and then the side of your neck. Now, this drainage system on the side of the neck can sometimes be shared with things that concern the nose and the head, etc. and the bottom of the chin. But if you feel any lumps, the best thing to do is to get it checked. So key points again, think about it if you are examining a fruit. Look at the skin, look at your skin, any dents, any dimples, any rashes, any discolorations, any at all. You want to look at the movement of your breast to see if there's any dimpling or turning in of the skin. You want to feel for any lumps or any small things. Now, if something is cancerous, it tends to feel like if you take your finger and you tap on your forehead, it tends to feel hard and gritty like that. And some things that are non-cancerous tend to feel kind of more boggy, but the best thing to do is to get that checked. So you want to be doing your self breast examination every month. You want to be going every year to get your clinical breast examination by a doctor or a nurse. And then you want to be having your mammograms. Now, if you are under the age of 40 or you have very dense breasts, your doctor is also going to recommend to you that you get an ultrasound, because the ultrasound is going to be very useful for things that the mammogram might not pick up. Now, if a mammogram is abnormal, you may have some, right? If the mammogram is abnormal, you may see, they may see small little white specks on it that are calcifications. So there are areas where the breast is beginning to change, and those early changes, you can then go on to further investigation, which is what I want to talk about. So you want to, just to revise here, check the appearance of the breast, check the movement, also look for lumps, etc. Check your axilla, which is the armpit, check the area for the clavicle, check for the nipple discharges. Okay, all right, okay, so just let me go here. So how do you know when something is really, getting out of hand? One, you want to check on things really early. But if your nipple is turning inward, if you're having a distortion in the change of your breast, if the skin around your areola or the dark area, sometimes if you touch that, it would tend to automatically, because of the nerves, it will tend to crinkle a little bit. But if it's looking scaly, if it's looking like it has a rash, if it looks like almost like the area around it is getting, and the whole breast might be getting turgid and heavy, like how the skin of an orange would look, you want to make sure that you are getting that checked. Now, let me just come here. So some persons, they don't take action because they're not sure about what is going to happen. So one of the things that that I would want you to know is that, in essence, you cannot say that a person has cancer and the kind of cancer unless you take a sample of it. So it's like you can see a cake from the outside, it may have a chocolate coating, but there's no guarantee that when you go and you cut it, that it's not strawberry on the top, blueberry and chocolate, etc. So in order for us to understand how to treat cancers, we need to take a sample. And so that sample is usually taken using a very fine needle to take a sample of it. And then if needs be, you might take a wider piece with a surgeon would do that. And then there's sometimes where by the time a lady presents, things may be to the extent where once you take that small sample and you send it for testing, if it comes back showing that the situation is cancerous and the rest of her body has no cancer spread to it, a decision may be made to offer the lady treatment that might involve removal of that section, or removal of a wider section, or removal of the entire breast with sampling of the lymph nodes under the arm to see. So the treatment of breast cancer is always going to be dependent on the stage, and stage is different from function as well. So a stage, when we talk about stage, we are usually talking about, let me just go to the next slide. The next slide, we are talking about stages 1 through to 4. Hold on a minute. Chat question: how often should someone over 70 have a mammogram done? Okay, we could yes, we can answer that. Okay, so I got distracted by the question, but stage. So going back to the stage, you can have from technically stage 0 through to stage 4. And the stage depends on the size of the tumor at its local site, the presence of lymph nodes, and whether or not the tumor has spread to other parts of the body. Now, I think if there is one thing I want to say here is that treatment depends on stage. What the doctors offer you or what you decide to do should depend on the stage. And stage is also linked to the functioning of your body. So, for example, I may be a person who has breast cancer. It's stage 4, meaning that it has spread to once a cancer has spread from where it started to any other part of the body, it is automatically stage 4. So if it was a breast cancer cell and it has spread to my bones, then that's stage 4. So the cancer could be stage 4, but I am functioning well. I am functioning well. I am moving, I am eating, I'm maintaining my weight, etc. So I can be stage 4 and I can do well. There is this premise in Barbados, including among some health professionals, that if you're a stage 4 with a cancer, that is somehow a death sentence. It is not. It depends on the functioning of your body, and you always want to make sure that your body is functioning well. You want to make sure that you're eating well, that you're exercising, that you're taking all of your necessary treatments, that your mind is staying positive, you're surrounding yourself with positive persons, and you're giving this your absolute best. So the hallmark, or I should say hallmark, one of the mainstays of cancers, it depends on treatment, depends on stage, but treatment also depends on which kind of tumor it is. And that's why sometimes I get a little riled up. Honestly, I'm not going to pretend with you. I get riled up and I get very, very disappointed with people who say to people, you know, doctors are mean and they're only interested in money and da 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 da. And we have well-meaning, intelligent Adventist women who delay treatment because of stories that they have heard, and they try all different kinds of things, and then sometimes they present when things are very, very advanced. You need to avail yourself to biopsies so that you can know what it is that you're dealing with. So you can have tumors that are lobular, that are coming from the lobes, and these are so well behaved. They are hardly going to give you any trouble. But a ductal tumor, a tumor that is coming from the duct, it can be, especially they're high-grade tumors and they're behaving very badly. When you look at them under the microscope, they need a heavy stick to help them to stay in line. So two people having breast cancer does not mean that they have the same kind. And also how God has made, this is my other illustration, how God has made cancer cells and how he's given us the ability to fight them is that they have these little receptors on them, almost like sticking up of sorts. And depending on the analysis that you do, you can tell which kind of receptor or marker is on the tumor, and that can tell you how to treat. So there's some women whose tumors will grow because of estrogen. There are some women whose tumors will grow because of the presence of progesterone, which is another hormone. And there's some women whose tumors will grow because of something that's being modified called Herceptin. So before we used to have the potential to do these tests in Barbados, but now right now we have to send them out to Miami. But depending on how this comes back, this tells your doctor which medicines to use, but it also tells you a little bit about how you can eat as well. And then there's some women, I'm going to turn it upside down, their tumors have no markers at all, okay? And we will say that those women are triple negative. So you see that this is 1, 2, 3. So some women, they are triple negative, and those are the hardest ones to treat. So it burns me to the core when Adventist women, because I know us, we don't figure out what kind of tumor, we don't figure out which kind of marker, and we listen to well-meaning people, and we don't get the full benefit that might be possible. So that having been said, if you know the kind of tumor it is, you're better able to design treatments. And we cannot, as Seventh-day Adventists, be like Asa, where it says that Asa called on the physicians, but he did not call on God. We cannot put our trust fully in man. We have to do, I would recommend that we're listening to God, and we're listening to God, understanding the knowledge that he has given physicians and other persons to help. So you are modifying your diet, you are exercising, you are, as Jimmy said in the chat, you're doing New Start. But I'm going to stand here and tell you that there are many of us who would have had surgery and chemotherapy and are doing well, but can't say that to anybody, because if you take chemo or you take surgery, etc., you are seen as somehow lacking faith. And I don't believe that that is true. I think that God has given man medicine to help us if used correctly. And likewise, if we are going to be using things that, anything that we have to be putting into our bodies, whether it's from allopathic medicine or complementary or whatever other kinds of medicines, we have to understand how things are working. We need to understand their side effects. So that's why I'm going to get into the question that was asked about chemotherapy and the chemotherapy side effects as well, and the good cells and bad cells question that was raised. Okay, so I am going to leave this slide deck with Kiana. Probably one or two modifications, but these are the various stages. Yes, and as I said before, do not panic. Do not panic. So the traditional treatments are on top. In terms of the treatment, depends on stage. You may be offered surgery, radiation, chemotherapy, hormones, and now there are newer immunotherapies that are precision. Complementing these. Exercise is an absolute must. A positive attitude is an absolute must. Making sure that you are maintaining a healthy diet that does not, that follows the pattern that we would have mapped out in terms of water as your beverage of choice, not using added sugars, healthy options for oils, high in fiber, using plant-based sources of proteins, thinking about your ellagic acid berries and your lycopene-rich fruits and vegetables, high in cruciferous vegetables. You just have to do that, and bringing your body mass and your waist to hip ratio into normalcy. So people might say that you're losing weight and you don't have the traditional body size. You might not be curvy and fat, but it's okay. It's going to be the best thing for you if it is that you are fighting a battle with breast cancer. And I have patients who have been doing very, very, very well when we do this, when we are doing these combinations. Okay, so I want to get into the Q&A and answer the chemotherapy question based on that. God in his wisdom, the first and second line treatment for breast cancer is, first line is a medication called adriamycin. Cyclophosphamide is the combination, but adriamycin, doxorubicin. Adriamycin, the chemical comes from a bacteria, so it's naturally derived. The second line treatment, they're taxanes. The taxane medication group, people call them paclitaxel, docetaxel, paclitaxel. Those are derived from, originally identified and derived from the Pacific yew tree. So there are tremendous benefits. They're not related to breast cancer, but like the little purple periwinkle flower that we have in our garden, that is the root source of vinblastine, which is one of the chemotherapies that can be used to treat certain kinds of brain tumors. So when I hear people say that chemotherapy is terrible, I would say fundamentally people have to decide for themselves. If you use anything and you use it without knowledge and without knowledge of the side effects, it will cause you damage. So I will use this example. Ginger root is a natural blood thinner. Cassava that we cook. Depending on how you cook the cassava, if you have problems with your liver, even if you don't have problems with the liver, cassava can be it can be toxic to your liver. If you use moringa and you use it incorrectly, moringa has strontium, it's going to be toxic to your kidneys. It depends on what you're using, how you're using it, and whose body you're putting it into. So not everybody will be a candidate for chemotherapy if their body is not strong enough. Chemotherapies are not used without, so I am going to say here, the way how we are trained in medicine, how persons are trained in medicine, anything that is given into the body is designed to reverse and to not damage. And so I would say that once you listen to the side effect profile, if you are not happy with the side effect profile, talk to your doctor and tell your doctor or your healthcare professional and work out the plan that works best for you. But there are pre-medicines that can be used to modify negative side effects. So say, for example, when we were learning how to make nutmeg tea, you know that when you're making nutmeg tea, you're only going to grate a little bit of nutmeg into that water to steep it. Do we understand why? Because nutmeg is a cyano compound. It will damage the liver if you use too much of it. So we have some natural knowledge that has come down to us that says this particular thing, only use it in a particular way. Likewise, chemotherapy, when done well, you know how much to use, who to give it to, and it's combined. It's based on your age, it's based on how strong your body is, and also based on the type of tumor that you have. So I would say if anybody is genuinely interested in understanding chemotherapies and how they work, I'm happy to continue talking about that. But you will have side effects. Everything has its side effects. So as it relates to the destruction of good cells and bad cells, there is a natural cell death that occurs, but there's also a natural proliferation and regrowth that occurs. Where a problem can occur is if there is no natural proliferation that occurs. And that's why when you're having chemotherapy, you're constantly being monitored to make sure that your cells are naturally proliferating. So in between cycles, your hair cells will proliferate, the cells on your tongue, everything else will automatically bounce back. If for any chance your immune system is super stressed and the cancer is really aggressive and it's not, your body is not responding, the dose of chemo may be reduced, it may be changed, the kind of medicine may be changed, etc. But chemo is not designed to destroy and wipe out good cells without monitoring how they are proliferating. You constantly have to monitor how they are proliferating, and if the good cells are not returning in the way that you want, the oncologists will modify. Okay, so this is my parting advice, and I see Dara's hand and related to mammograms. Now, after a certain age, mammograms are not necessarily recommended because it's a combination of you are usually screening a person in order to make an intervention. If the person is active and healthy and expected to have a normal life expectancy, your doctor will work out with you to continue mammograms every 2 years or so until 75 plus, depends on the density of the breast. But there are some women, if they've had a series of normal mammograms and they're very low risk, etc., their doctors may opt to defer to clinical breast examination and then intervention after that. Okay, so it also depends on your race and it depends on your age. But I can give some other documents that your church members in your health club, I believe this is Black Rock Church and you guys have a health club. I'm not sure when you're going to cover breast cancer in the health club, but I can give Sister Pamela some information that can be used. So Sister Kiona, I have a hand. Is it fine to just go right ahead for me to take that hand?
Yeah, no problem.
Okay. So after this hand, then I'll hand back over to you, and we can, and I'll take your guidance on where we go.
Okay, I was just asking, what about soursop? Is it helpful for breast cancer?
Okay, so graviola, which is soursop. So there are some things that seem promising or potentially interesting. They are not advocated as being alternatives, but rather complementary. The evidence around graviola is actually not with the leaf, which is what we tend to steep here in Barbados. The evidence is around the compounds that are within the seed. I think I've not been watching the progression of graviola extracts into full chemotherapeutics, but it is one of those products that is, there a few years ago there was a lot of buzz around it in terms of potentially being a new chemotherapeutic agent, but the challenge that was being experienced was the nausea and vomiting that you were getting from using the extracts from the graviola seed. Because as I said, everything has its side effects, but whenever a product has to come to market, it has to be tested for its safety. It has to go through trials in the lab, and then it has to go through trials on humans, and you have to test the side effect profile of it. So that is as much as I can tell you about graviola. But what I can encourage all of us to do, whether we are facing a diagnosis of breast cancer or otherwise, is to eat as healthily as possible. You want to generally minimize your exposure to processed and ultra-processed foods. And we know that the preservatives and or the processing that the foods have to go through, they're tending to be lacking in nutrients, etc. So you want to be sticking to that healthy eating plate that I would have mentioned. That plate was designed from the Harvard Medical School. So as I said before, water, avoiding added sugars, complex carbohydrates, high fiber, deciding to use your plant-based sources of protein, you're minimizing, if you're choosing to eat meat or you're transitioning from meat, you're choosing, chicken, turkey, fish, you are minimizing the use of red meats, which would be lamb, beef, and we're salmon, so I would still say it, but pork, and then you're avoiding the processed red meat. So you're not using what we will call the corned beef and the luncheon meats and the deli sausages and those kinds of things. You're pulling those things out of your diet, and you are leaning heavily on the vegetables and the healthy fruits options. So graviola is interesting, and the potential of the seed seems to be very powerful. Just have to, in terms of bringing products to market, sometimes it may take a while. If you are interested in how to use these things in Barbados, you have Armanda Chase Grant from Mount Sinai. She is a trained medical herbalist. You can probably talk to her. She has, sometimes if I have a client in the past, because I'm now 8 hours clinical, if I have a client that they do not want to use chemotherapy, they did not, for whatever reasons, they have a lot of misgivings, etc., etc. It really burns my heart when people walk away, because I do think people do better when they do both. But she is the person that I would advise persons to go to, and she has pathways to bring in some other herbs, etc. And she is very good because she looks at the labs. A lot of other persons don't. They will tell you do this and tell you do that. They have no idea what's happening in the microenvironment of your blood, of your tissue. They don't know your histology, your tumor type, your tumor markers, or anything. And that's why I say it's very important. If you're wanting to go complementary therapy, you have to go to somebody that knows what they're doing. And I've seen too many cases, especially recently in our church, where people have died unnecessarily. Makes me very upset, but God knows why. Kiana, over to you. Deidre, I hope that helped.
Okay. Before I close out, does anybody have any other questions? This is your time. Final boarding call. Any other questions?
What about the processed veggie meats that we buy, like the big fries and the super links and the worm and all those things?
Yeah. So in terms of they're not necessarily the best things. Those are transition meats. I think those should be used for a short period of time for persons who are trying to transition from meat to predominantly plant-based diet. Those are very high in sodium, for one, for the most part. Thankfully, the ones that we tend to use tend not to be preserved in nitrates, but anything that's going to be high salt and or has nitrates in it, so things that tend to be caramelized or are brown in their preservative color, they are going to tend to increase your risk of other things. So colon cancer in particular, nitrates and salted foods, colon and stomach. So you want to be staying away from things that are high salt, just generally, and things that are preserved with nitrates. So I would say, I can tell you my personal practice is to buy them sparingly, and they're not a regular part. They should not be a regular part of your diet. They're really transition foods. Does that help, Sister Barbara?
Yes, please.
Okay.
Can I follow up to her question and then ask, like, what are we supposed to eat? Not in the very serious way, because there are a lot of things are either preserved, handled incorrectly, and then you also face the issue of having a repetitive diet, which is not a problem, but could become boring for some persons. And in that way, you might not be able to sustain it for a very long time. So what are
Absolutely. I think one is to know your baseline ingredients, and if anybody has a paper or a pen, I will give you some baseline ingredients. And then I think the thing is to then have a cooking school or something that shows you then how to combine your baseline ingredients, because then you recognize that you might have many things, but then you can make them in particular ways. So for your beverage, if the beverage of choice is water, and you're struggling with having water be your main source, you can try infusing your water with various things. So you can infuse with ginger, infuse with cucumber, infuse with some of the berries, etc. if you wanted to change color and taste. So I would say if a person is getting tired of water, try water with various kinds of fruit infusions, including, I'm counting cucumber as a fruit infusion. So you can do that, and you can for variation change your containers, your glasses, etc. And you can have your tea options as well. So if you are into and can safely use various kinds of teas, you can, teas are not going to give you calories. So if you want to then have things like chamomile or berry or vanilla infused teas, again, ginger, nutmeg, cinnamon, those kinds of things. Those combinations of things can give you lots of variety. There are some persons who, if they have the time, can also change their liquids by juicing, right? So you can try various combinations of juicing. And Mr. Noel is not here, but I'm going to put a plug for the ABC bookstore and the various kinds of juicing books that they have. I have a book called the Juicing Bible. I was looking to see if I could quickly snatch it, but I could give Kiona the name. And you can have various combinations of juices that can also be very useful and not only work for hydration, but they can also give you antioxidants that will help with other things. I know we're talking about breast cancer, but this can generally just lift the way how your body works. So you can juice your alkaline. Well, I think it was Sonia. Sonia talks about the alkaline foods. Sonia will use the word alkaline. I would talk about cruciferous vegetables. Some people use them interchangeably in terms of things that are going to add natural phytochemicals, and they're not going to stress your kidneys, and they're going to help to keep the environment of your bloodstream good. So you can juice your cruciferous vegetables. Then in terms of your baseline for your carbohydrates, sources of carbohydrates. So the default carbohydrates that tend to be cheap in Barbados tend to be the pastas, like the chow mein and ramen and the various kinds of things. Those tend to be refined pastas. But if you like pastas and you're still wanting to use pastas, you might want to still use the pasta, but then you're going to be using it using the whole grain form of the pasta. More pricey on the pocket immediately, but better for you in the long run in terms of your body's going to be healthier. It's going to do better longer, and you don't have to spend that money then on medicine bills or any other kind of thing. So I would say if you know that you're a pasta person, probably default to the whole grain form, which is probably going to be less refined, but know that it's going to be refined in some way. If you're using rice, you can opt for the brown rice. That is going to be a little chewier, might require more water, but it's going to be a good source of fiber. Now, with moderation, depending on if you're diabetic or not, you can use English potatoes. You can use sweet potatoes in their various forms. So you can mash, you can bake, you can grill, etc. Know that carrots and squash and pumpkin, they count as starchy vegetables. So you can bring them over to that column and you can mix them with your rice, your pastas, etc. if you want to increase the carbohydrate count of some of your fiber mixes that you're doing. So if you want to do a Spanish rice or a Spanish type pasta, or if you want to do what people would call breadfruit salads or different kinds of steamed salads or grilled vegetables, you can bring over the carrots and the squash and the pumpkin onto those different kinds of your plate. To know that corn is understated and undervalued. Corn is extremely useful. It's a very good whole grain. So if you want to include corn in your diet somehow, so cornmeal porridge, as people would usually talk about, cuckoo, etc. Very, very, very good source of fiber. I think the things like the quinoas and the basmati rices and the Bulgar wheats and so forth, they're expensive in our context. So I would say to persons to default, if there's some people whose breast cancer tumors might be so estrogen sensitive, this particular receptor might be so sensitive that they might not be able to use things like yam. But if you can use yam and you can use eddos, etc., you can, and all those things can be steamed, baked, mashed, and there's other kinds of things that can make them interesting. And then there's some plants that are useful because they're flexible in how you can maneuver them. So like aubergine, or what people call eggplant, provided that you don't have like arthritis. Some people get their arthritis flares from that. So in essence, and then you have your various forms of peas and beans, etc. And then you have your nuts that you can make into various kinds of things. Anything from punch, you can put your peas, your nuts with your carbs as well in nut rice and various other kinds of things. So I think, Kiana, the thing would be, before I could go and make people too bored, is to make sure that you have the gamut of peas that your body likes, that don't make you too gassy. You can use something like cumin or jeera with them to reduce the amount of gas that you are producing when you are digesting. And then separate and apart from that, layer on top of that the nuts and peas, the nuts that you can afford, whether peanut, walnut, almonds, etc. And then the fruits, that whatever fruits you're not allergic to and that are seasonal, in addition to the imported berries, and just have fun with the vegetables. So I think a lot of it might be to take a meal that you like, and this is where your health club can take a meal that you like and then transform it. So transform it from the high processed, low nutrient, transform the meal, make the thing that you like, but in a healthy way. So say for example, I might like Campbell's soup because it's salty and it's a quick fix or whatever, but it's going to be high in sodium, low nutrient. But maybe I can get some quick cooking lentils with some tomatoes and some onion and celery that are going to be high in potassium, and along with some onions, and maybe if I can and they're available, some leeks and some finely chopped tomatoes and finely chopped potato, and I can create the same thing and so forth. So I think a lot of it comes down to to skills of people like Esther Salmon and the various other nutritionists, Stacia Whitaker and stuff like that. So maybe you bring them in to help you. Does this help, Kiana?
Yeah, for sure.
Okay. All right, great.
All right, and we're about to close. So I have one last thing, which could be answered really quickly. And it just asks, should we avoid all food with bioengineered products like cornflakes?
With what kind of products?
Bioengineered
Oh,
products.
bioengineering. Okay. Okay. Okay, so all cornflakes are not bioengineered. So there's bioengineering and there's also the concept of processing, right? And I know that there are persons who are panicked about using products that have been altered. And I would say the best scientific guidelines is to use natural foods as possible and to use them in their whole form. So I'm not going to tell you to avoid cornflakes because I don't know what your budget can hold. And I don't know if you remove cornflakes, what will you use as the alternative? But I will always say that the whole food and the less processed that food is going to be the better for you. So if you are wanting corn in your breakfast, maybe you might want to use cornmeal as well. And what you may find that some of the refining process of the cornflakes, the pure cornflakes, sometimes the whole grain component is not necessarily transferred. So if you are trying to buy a cornflake, you might want to buy something that still says that is the whole grain that has been used, because then you might end up with things like constipation and stuff like that. So I'm not gonna be so prescriptive to say don't use X or Y because I don't know if I tell you that what you will do, but I would say better to do whole and as natural as possible as far as you can. Yeah. And Sister White has a statement where she talks about the fact that she does not want to be anyone's conscience and that we all have to be wise enough to make decisions for ourselves. And I want to say that there's knowledge, and where knowledge might be lacking, you may seek a person for advice on the best sources, but also think for yourself as well. Does that help?
Yeah, I hope it helped the person.
Okay, I hope so. I hope so too.
I know we ran a little long, but it actually didn't feel like that. So I'm gonna.
That's good. I was late in joining. I was late in joining. We would have gone too long.
That's fine. I'm gonna try to be very brief in closing. Firstly, I want to extend my gratitude on behalf of myself and the AOA team to Dr. Natalie Graves for accepting the offer to come and present on this topic. I have come to understand that, and then also based on the questions that you received, that we can be very misinformed when it comes to certain things. We can have various misconceptions sometimes as the Adventists, sometimes by default, sometimes by influence. But I'm very glad that we were able to clear up a lot of the murkiness, not of the nebulousness. And I hope and pray that those who were blessed to be able to hear firsthand, about breast cancer, about the factors, about the things that we can do to prevent it, that we don't just let this information fall on deaf ears, that we don't keep it to ourselves, that we share it with persons that we truly care about, that we share with strangers that may have questions. My take, I would encourage persons to use academic approved sites, use the resources you have available to you, your primary care physicians, persons who are well versed and well educated in the topics, not just opinions. Opinions are okay, but also make sure you follow up and fortify said opinion with facts, actual facts. We have the information available to us. We have resources available to us. And like Dr. Graves was saying, I would hate that for any of us to become susceptible to this terrible disease and, fall on the terrible side of it because we were misinformed or because we chose not to, take an avenue that did not work out for somebody else because of their choice. So in closing, I am going to take, or rather make my email available to Natalie so that I can receive the power plan. In so doing, share it with Sister Pamela for the health department. And I'm also going to try to do my part as best as possible. No, we're going to close not the year, but maybe Sister Pamela could help me in, bringing in persons to help us to traverse these topics and, help us to stay up to date with the information and as knowledgeable as possible, because it is very, very, very important, not just as Adventists, not just as women, but as human beings. We want to live very whole and healthy lives, live for as long as possible to, that 70-year-old mark that God has blessed us with before any issues, if they could be avoided. So I am
Fiona,
just, yes, please.
before you go, I just wanted to end off with reminding everybody to have faith and trust in God and to live a life where they are helping others and they are being grateful. Yes, getting into nature and being grateful and being happy. I forgot to mention that there's a lot of work being done on the power of the mind and thankfulness and gratitude and how that translates to reducing stress within the body. So I just was closing off, getting my pen to write your email, and then I was reminded that I want to just mention that. So thankfulness and gratitude and positivity, all very important in cancer survivorship.
Okay, thank you. And honestly, as a medical fanatic myself, this has really helped me. I hope it helps because, sometimes it can make it a little more scary than usual. But I hope that it helps and that I could in turn translate this information to make it actionable in my personal life in terms of diet, exercise, and all the things that I can do to prevent these things from occurring. So everyone in the listening of my ears, I'm going to ask you to bow your head, close your eyes as we dismiss with a word of prayer. Dear kind of Heavenly Father, I want to thank you first and foremost for life. I want to thank you for spirit life, dear God. We know that a couple hours ago, we were faced with some weather challenges, and we want to thank you for allowing Hurricane Tammy to veer off from us. And in so doing, we were able to sustain or be welcomed with not as harsh conditions as were predicted for us. I want to pray for those that are in the line of the way of Hurricane Tammy, and that you would just cover them and protect them, that you would infuse and influence those in power with wisdom, dear God, to handle these situations in the best way possible. I want to thank you for allowing that Natalie Graves to process and discuss this information and provide this information in a way that was understandable, in a way that was digestible. And I pray that this information truly would not fall on deaf ears, dear God. We know that because we were born in sin, and shaped in iniquity, that we do have to face certain areas of discomfort in our lives, dear God, but you have promised us that you will never leave us or forsake us. And you have also made sure to give certain individuals the gift of knowledge, the gift of wisdom, the gift of understanding, dear God, and so that they would help to develop science and develop medicines that will help to aid in our betterment, dear God. I pray that you will continue to guide us, continue to influence our thoughts and our actions, dear God. Continue to remind us that the way that you provided in terms of diet and exercise are the best way to go to ensure that we keep these bodies that you have lent us in the best standards that they could be. I pray that as you close out this Sabbath, dear God, that you will be with each and every single person. I ask that you will bless them as they go into the week. I ask that you would nestle them in your arms, dear God, that you will make their path straight. I ask that any issues that may be bothering them, dear God, any things that we may not be aware of, dear God, that you would remedy, that you would take full control of the situation, dear God. Again, thank you for the Sabbath. Thank you for being able to worship and fellowship with like-minded people. In Jesus' name, amen.
Amen. Amen.
Dr. Graves, I'll send you a message from my
Okay.
email.
All right.
Amen.
Thanks, everybody.
Have a great
good
night, everyone.
Okay. Bye-bye.
Night.
Bye.
Thanks to you all. Good night.